through a pandemic. On March 12th, I sent a letter of last year, on March 12th, I sent a letter out to the community. In that note, I shared that school would be closed for a 2-week period. On March 17th, our messages started introducing the idea of social distancing, and by April, we were talking about lockdowns and managing the health and safety of our community. Like the governor and the commissioner, we're learning daily. We were learning about the science of viruses. We were learning about public health and mitigating the spread. But we were also learning how to connect with our students, rapidly deploying computers, creating new learning units, and finding ways to make sure every child in Newburyport was seen. We ended our 2020 school year with a drive-by graduation, a parent parade, so boisterous and fun. We had gridlock in our city. Sorry about that, Mayor.
It was wonderful.
The Clipper community, like every city and town of Massachusetts, celebrated and brought closure to a school year with great uncertainty about the fall. Massachusetts is a proud state, and we rally around great sport teams. In the words of Patriot coach Bill Belichick, I think that really summarized our summer. For our staff and the administration, there's been no days off. And although we're weary and we're weathered many losses, the Newburyport community has rallied to call for action. We faced many complex educational, operational, and personal questions last summer. The conversations were not always easy, but the teachers, the families, the students showed that in Newburyport, adversity can bring us together. As we work through this summer, scientists, epidemiologists, public health experts were learning more and more about the virus. Guidance from the governor's office, guidance from the Department of Elementary and Secondary Education has helped us see the path to begin to move forward for learning. In September, Newburyport staff returned to the buildings, the first time since March 12th. Our buildings were open for business, but business was not as usual. 50% of our furniture was removed, every space was reimagined and redesigned, a remote academy was developed, PPEs were purchased, and remote teaching stations were created, and there was much, much more. On September 16th, students came back to school, some choosing to go remote, but most participating in our hybrid model. We all wore masks, we taught each other how to keep a distance, we used hand sanitizer stations, we set up over each school, and we found many ways to use technology to keep our children safe, learning, and engaged. We now have passed the 1-year anniversary of the first cases of COVID-19 in the United States. We've lost many, many neighbors and loved ones. In Newburyport, we remember the parents, the grandparents, the sisters, the brothers of our colleagues. We also continue to care for our friends and family who are struggling with this virus. And although we pause to recall the hardship, we do not stand still as we plan to move forward in the future. Today we're seeing the hope of vaccinations. As we witnessed today in the library, COVID testing evolved and has been made available to us. And thank you to our governor, thank you to Commissioner Riley and Secretary Pazer. We will continue to keep our distance, we will wear our masks, we will be remembering all of the mitigation strategies used together that always will keep us safe. I am very proud to lead the Clipper team. They're another team of Massachusetts that we can all be proud of. And with that being said, I would also like to personally thank Mayor Holliday and our school committee members, because it's been a true team effort in Newburyport, and I can't be more proud and honored to be superintendent here. So at this time, I'd like to call up Mayor Holliday.
Thank you, Sean. Appreciate it. Oh, good morning. What a joy to be at an event with people. Zoom is getting really, really old. So welcome, Rep. Pelkhorst. I appreciate you being here. Thank you. Commissioner Riley, Secretary Pazer, Governor, and of course, Kathy Riccio. We wouldn't be here if it wasn't for our amazing nurse who has really signed us up for this pool testing and has continued to lead the health advisory of our school district during this incredible pandemic. I'm very proud of the work that our school district has done since the day we opened. We are a district that never reversed course. We never closed a school. We never closed our district. We set a phased plan and continued to move forward. This pool testing now and surveillance testing is another tool that will continue to help us advance and bring more and more children back to in-person learning. And I'm very grateful to Kathy and to our school team to be part of this plan. We have a tremendous relationship with Governor Baker and Lieutenant Governor Polito, a partnership that started from the day they took office. We have the Safe Routes to School program, for example, that will be finished in the spring. We have a Complete Streets that will finish the gap in our beautiful rail trail, a resiliency project on the river. I mean, the partnership has run very deep because this administration understands, parking garage too, can't forget that one. Yes.
The most beautiful parking garage.
He's never going to let me forget that. But they truly understand the needs of our cities, towns, and our schools and have provided us with the resources to continue to succeed. During this pandemic, I don't know what we would have done without the ESSERS and the ESSERS 2 funds now available, as well as the CARES Act, as we come together as a community to continue to advance our city and our school district. And I'm very grateful for DESE and our governor for that level of support. So here we are today, and I think about, as you heard our superintendent say, the amazing challenges that we collectively have worked on to advance our school district and our city. Now take a step back and think about this one community and now add another 350 and think about the weight that has been on our governor's shoulders. I commend him and his administration for doing an incredible job of leading us through this pandemic. And we would like to just ask that in mid-March, we're hoping the rollout of the vaccine will reach a point that we hit teachers. We've worked out an arrangement with our EMS to vaccinate our teachers. That with pool testing, vaccinating our teachers, we will end up with bringing every single child back into full person learning. And we've continued to make tremendous progress in that area. So would you please welcome our friend and our governor, Charlie Baker.
Good morning to all of you and to the mayor. I just want to say how much we appreciate the partnership and the work that we've done together over the course of the past 5.5 years. And I must say, of course, for all of us, the last year in particular has been among the most challenging. I say all the time that when I ran for office, I knew I'd be dealing with hurricanes and snowstorms and floods and ice storms and natural gas explosions and a whole bunch of other things, but I certainly didn't expect to be dealing with this. And time again, we've had a chance to watch the resiliency, the creativity, and the diligence and the determination of the people of Massachusetts shine through. Superintendent Gallagher, I also want to thank you for your leadership throughout this, and I just want to say to the team here at the Nock-Molin Middle School, congratulations. I'm really glad I had a chance to watch the pool testing program roll out here this morning, and I do have to say that I looked around and I saw a whole ton of young women who all looked like they were about my height. And I turned and I said, hey, it's great to see the basketball teams here. And it turns out it was actually the volleyball team. And I continue to be disappointed whenever I see all that great physical talent being used in a sport that's not the one that I played. But I also, Joan, just want to say thank you to you for not only being a third grade teacher, which I remember my third grade, so I'm not sure I would have been on your nice list as a student back then, but I just want to say thank you for your leadership on this and so many other issues here in the Newburyport schools. And I did want to actually come up today and take a look at one of these pooled testing programs, because this is something that we've been working with the labs here in Massachusetts and with a number of the school districts on for quite a while. And to get to the point where this thing is really starting to rock and roll is a real pleasure, I think, for all of us who were looking to find a relatively uncomplicated way for schools to implement a weekly surveillance program. And you folks were one of the first in line. And again, I just want to say thanks to Sean and the rest of the team for stepping up in that, and for the mayor. And I'll talk a little bit more about sort of how this thing is rolling out in a second. But I do want to give a quick update on the COVID numbers, which has become sort of part of my daily routine. There are currently about 853 people hospitalized in Massachusetts with COVID. That's down from over 2,400 less than 2 months ago. There are about 221 in the ICU. That number is about 50% of what it was 6 weeks ago, both demonstrating significant decreases in these numbers since the peak back in January. Yesterday there were about 1,900 new COVID-19 cases confirmed here in the Commonwealth on a test batch of about 120,000. The 7-day positive test rate is now down to about 1.85%. That's a number we haven't seen since last fall. Those trends have allowed us to move forward in our reopening program, and yesterday we announced that beginning March 1st, Massachusetts will advance to step 2 of phase 3 of our reopening plan. We continue to ramp up our vaccination program. We vaccinated at this point with first doses more than 1.2 million people, and we are in fact number 1 in the country at first dose vaccinations per capita for any state with more than 5 million people, of which there are 24 others. Nearly 80% of the total doses we've received, about 2 million so far, have been administered, and that number, that 80%, will continue to climb over the course of the next few days until we get our next batch from the feds next week. Basically, about 100% of everything we get at this point is being administered within 10 days. Yesterday, there were 50,000 new appointments that were booked at mass vaccination sites for next week, and the number of appointments that get booked depend to some extent on how quickly we can see the feds ramp up their vax program and distribution program. And we know this process is frustrating. Everybody would like to get vaccinated tomorrow. What I can say is as the feds increase their supply, we will increase our appointments right along with them. Our goal will be to make sure that every dose we get finds a home as quickly and as safely and as conveniently as possible. This pooled testing program, which we were here today to take a look at, is something that got launched as a first-in-the-nation demonstration a few months ago, basically to add a key tool to school districts and to schools, which was the ability to do some sort of pretty consistent, relatively uncomplicated weekly surveillance program around testing. So far, there are about 950 schools in the Commonwealth that are administering these weekly tests to about 300,000 students, teachers, and staff across the Commonwealth. This is something, from my point of view, that I was really looking forward to getting a first-hand look at this morning, and I want to thank people for giving us the walkthrough and the chance to take a look at it. And I do want to congratulate the folks here in Newburyport for standing this up and making it happen and willing it through. In some respects, your enrollment in this pooled testing initiative is a big part of how we keep kids, faculty, and staff safe as we move forward with all we can do to try to make sure the kids have that personal and professional and physical opportunity to spend time in school. And I got to tell you, I was not expecting to see a phys ed program when I got here this morning. I think in many respects, the way you teed that up and lined it up. And by the way, it's also kind of nice to hear Aerosmith is one of the bands that was being used as part of the live music for the kids during all that. And I think in some respects, I just want to say to the mayor and the superintendent, to all of the teachers and to the folks here, including the 2,300 kids that they serve, that this is really a terrific program, and I'm glad you were able to stand it up and to make it work. And I think in some respects, for all of us, this is a big part of how we create and build what I would describe as whatever the next normal is going to be here with respect to life, both toward the end as we turn the corner here and down the road with respect to how we manage COVID. I think for us, the most important thing I would say is this is the 1-year anniversary of the pandemic, and over the course of the last 12 months, it's been incredibly challenging for kids, for families, for teachers, for schools to work their way through all this and to find a way to try to keep kids engaged, involved, and growing and learning despite the difficulties that have come with the pandemic. And while we've certainly made progress with respect to vaccinations and mitigation, we really need to continue to find ways to make it possible for schools to be operational, for kids to be in school, and for everybody to feel like we're doing all we can to make sure folks know what is actually going on the ground. And that's in many respects why this program in particular is so important. And it's also why our administration has put literally millions and millions of dollars into PPE and supplies and hundreds of pages of extensive guidance and public health and safety guidelines for schools. And in addition to that, put about $1 billion statewide of COVID-related funding and supports, including rapid mobile testing for students and staff, and now this pooled testing initiative as well. I also do want to take a minute to thank Kathy Riccio and her team for all that they've done. It's nice to know that you're a North Shore kid. We all appreciate that. I also know that I heard this morning that you've been named the Massachusetts School Nurse Administrator of the Year by the Massachusetts School Nurse Organization. I think that deserves a round of applause. And you have certainly stood tall in this community, providing guidance and advice and leadership as everybody's worked their way through this. And I do want to give you a governor's citation honoring, recognizing, and appreciating what you've done. Now, it's very pretty, okay? On behalf of the citizens of the Commonwealth, I'm pleased to confer upon you this governor's citation in recognition of being named the Massachusetts School Nurse Administrator of the Year for your demonstrated leadership during the COVID-19 pandemic. The Commonwealth also commends your ongoing commitment to promote the general health, wellness, and safety of the students and staff of the Newburyport Public School community. 26th day of February, 2021. Congratulations.
Thank you.
I shake your hand, but we don't do that.
Thank you.
Okay.
Thank you. I work in the third district.
Questions?
Governor, only about a quarter of the schools in the state are actually taking part in the pool program. Would you like to see more? Why aren't they doing it, and what effect will it have on the reopening of the schools?
Well, I think generally speaking, and this is one I should probably where's the commissioner? I should probably let you take a crack at this too. One of the things we've seen almost from the beginning on almost everything that we've done to deal with the pandemic is there have been first movers, fast followers, and then the rest. And we're seeing that with vaccinations. We've seen that with pool testing. We've seen it with like a whole bunch of different kinds of initiatives that have been brought to bear to deal with mitigation and to create safety for people throughout this pandemic. And part of the reason I wanted to come here today was to promote the fact that Newburyport has teed this up and teed it up pretty successfully, but also to note that there are hundreds of school districts and schools at this point, and hundreds of thousands of kids and staff who are currently doing this, and we have the resources and the capability to do this for pretty much everybody. And I think sometimes what people really need to make the decision to go forward with something like this is the ability to come see how it's working at some peer institution. And I think it wouldn't be at all surprised if coming out of this you don't hear from some of the other folks on the North Shore who may decide they want to come find out what's going on here. But that, in some ways, from my point of view, is part of what this is about, which is to point out that there are a lot of schools and school districts doing this. There are hundreds of thousands of students, staff, and teachers who are participating in it. And I think folks are finding this to be a really positive element in their overall surveillance and safety programs. Do you want to speak to this at all, Sean? Or, excuse me, Jeff, do you want to speak at all to the broader question?
Sorry about that.
Good morning, everyone. Yes, I think what we've seen is there have been some early adopters, and a large chunk, where I think it's probably closer to a third of our schools, are entering into the program. And now what you're seeing is more and more schools that are interested in joining, and we've kept that window open, so we're going to continue to work with people. I do anticipate we will have a significant increase in the number of schools as the days go on.
Is there a carrot and stick that the DESI has to maybe get more involved in this?
No, I mean, I think it's a voluntary program, and we have been certainly financing the first 6 or 8 weeks of the program for districts to try to help them. As we did, you know, we paid for a lot of Chromebooks at the beginning of this pandemic. We paid for a lot of air purifiers at the beginning of this pandemic. We are trying to begin the process to help people get their kids into school more robustly, and so we are funding this to kick it off, and we anticipate many more districts will follow.
How many school districts does that translate to?
So right now, there's about 159 school districts that are doing it, and we anticipate there'll be significantly more in about a week and a half.
Commissioner, you have this funded through April 18th. What is the plan after that as far as paying for this testing goes?
So districts have been given different federal stimulus monies that they can use to pay for the testing.
Are you already thinking about looking ahead to next year? Because obviously you're still going to be somewhat in this next year.
Yeah, we're definitely working with the medical professionals to figure out what the plan will look like for next year.
And even in the school districts that are doing it, we were at a school in Arlington yesterday where most of the students in that school were doing it, but there's a percentage that were not. Is it important that you have buy-in from everybody in those districts?
You know, what I would say is it's not unlike masking. We really want people to invest and do the testing. But we also knew there were some special needs students that couldn't wear masks, and that shouldn't stop them from getting an education. So we think if the vast majority of kids in a school do the pool testing, that will really be effective to give another layer of protection for our schools, students, and staff.
Based on the announcement earlier this week that you're hoping to get elementary school students back in school 5 days a week, since then the MTA has sent an email out to its members saying that they're going to meet next week and try and figure out how to fight back. When you talk about these mitigation measures and the other information and these health measures that you've learned basically since September, what's your response when you hear that you're still sort of met with resistance from the MTA?
You know, we are always willing to work with the teachers' unions. We worked out an agreement at the beginning of this pandemic to provide 10 days of training for teachers. That was the only place, I think, in the country that did that, because we just value the safety of our staff and our students. We wanted to make sure we did it right. I would also say, by the way, that allowed us to start school on time by having that training. And so we'll continue to work with them. At the end of the day, the board will be taking a vote soon about perhaps bringing our elementary school kids back. We've said since the beginning we think kids need to be in school.
And you would still push forward with that even if the MTA says no?
I don't know what no means. I mean, what would that look
Well,
like?
I mean, their email to the teachers said that they plan to fight back. So they meet with resistance and they say they don't feel safe going back.
Yeah, I guess we'll have to cross that bridge when we come to it. I think right now our plan is to go forward with the board to take a vote to try to get even more kids back in school.
Any school district that wants to participate in this program can. I mean, one of the, if people want to play in the pool testing pool, we'd love to have everybody in. And I think part of coming here today was to point out that there are school districts and schools that are doing this, and can provide sort of that early adopter advice and guidance to districts that would want to kick the tires on it a little bit before they make a decision about something like this. But the resources, the lab processing capability, the logistical capability, the supplies, the resources, that stuff's all available. And I'd love to see as many districts as want to participate in something like this to sign up for it, because it's a really effective way of dealing with one of the major questions people have generally about this stuff, which is what's going on in my building every week.
Governor, the mayor alluded to getting teachers vaccinated. I know that in the next group,
Yep.
once we get through 65 plus and the two comorbidity, any plans to fast track them more than that so that teachers, might not have to go through the website or anything like that and deal with those hurdles?
I think what I would really like to see is some additional supply from the feds which I think is actually going to start happening. I mean, if what Moderna and Pfizer said in their congressional testimony earlier this week is legit, they're planning to do twice as many vaccines in March as they did in February. That would mean a heck of a lot more vaccine available to every state, including ours. And our problem at this point isn't the availability of capacity to deliver vaccinations. Our problem is we have more capacity than we have vaccines that are available. I also expect that based on all the noise coming out of the FDA, that J&J is going to get approved. And the beauty of that is it's a one-shot vaccine instead of a two-shot, and it doesn't require some of the deep freeze issues that are associated with the Pfizer and Moderna vaccines, which means, among other things, it's going to be a lot easier to transport and store. And they have already, J&J says they've already manufactured millions of them and are just waiting to get this approved. If the feds dramatically increase supply, that means we can get through the population that's involved here on the 65 and 2 comorbidity issue a lot faster. We can also provide a lot more supply to the channel, all the channels, which will make it easier for people to access appointments. And that will speed up the process by which we get to the next group, which includes, among others, teachers. So I hope that happens.
Would school nurses be the next channel for educators? Basically, the teachers come to work, go to the nurse's office, and get their shot. Do you see that as a path for distributing to educators?
Are we going to get the Upper Merrimack Valley thing going? What do you think?
Yeah, we met last week. We have another meeting this week. It looks Amesbury's going to take the lead. We're very excited about this.
If these guys put the regional collaborative in place, we just give the doses to the regional collaborative. They can figure out what the best way is to distribute them in the district.
I think the mayor mentioned mid-March potentially as a timeline for that. We're expecting potentially these teachers might be eligible for that phase.
Supply depending. Yeah.
Last question, for the districts that didn't participate in this, did you hear any hesitations as to why they didn't want to participate, and what are you hoping that they'll see maybe differently after seeing how it works for today?
I've talked to some people about this, but this is something that, honestly, if you have folks like Sean, or folks like Joan, or folks like Mayor Holliday, what a lot of people want more than anything is somebody they consider to be in the same shoes that they're in, to be able to speak to them about, how it worked, what kind of sort of disruption to the day, or however you want to define it, it might have created. Did the processing associated with moving the stuff to the lab and getting it back happen in a reasonable period of time? Was the Binex stuff available if people needed to do spot testing based on the results of the pool tests? Those are the sorts of things I hear from people, and one of the reasons for doing this on a sort of demo basis and giving early adopters a chance to engage in it is it does create an experience set that A, helps us and the department figure out if there are things that on our end that we need to do better, and B, it helps other school districts learn from their peers about what seems to be working and what the best way to organize it might be.
Thanks, everybody.
Governor, what's your biggest worry about schools considering we're one full year into this disruption? What's your biggest worry?
I'm not a pediatrician, but I talk to a lot of pediatricians, and they seem to have there are sort of three categories of things that I hear from folks who spend a lot of time around kids, including teachers, by the way. Number one, big concerns about just the isolation and the time away from their friends, and and that is an anxiety-provoking issue for kids. It just is. Kids draw comfort, actually, from the time that they spend with each other, and that is certainly one of the biggest concerns. That's an issue for adults, but it's absolutely an issue for kids, driven by the pandemic. I think the second is the difficulty associated with sort of figuring out where they are in terms of their overall educational attainment. And one of the reasons I think the commissioner wants to run some sort of an MCAS program this spring without necessarily having the same stakes on it is just to get a sense about where kids are, so that if we are able to fund pretty robust summer programming, we'll be able to do that to help a lot of kids sort of catch up on where they've been. And the third group is, the third thing I hear a lot about are sort of special needs kids who, I've heard just brutal stories from parents and from folks in the medical community about not just the fact that a lot of special needs kids haven't moved forward during this period, but many of them have actually regressed. And there's going to be a lot of work that's going to need to be done once we get past this whole period to just help kids get back to where they were. I think the folks in the education community have done unbelievably comprehensive and significant workarounds to deal with a lot of the issues associated with the pandemic. School is a big socialization activity as well as an educational activity, and it's always been sort of a hands-on activity for teachers, for staff, and for kids, and that's been a big part of why it's successful. And moving everybody to a completely different way of trying to accomplish the same set of objectives in a model that is so different than the one that everybody has sort of built their capabilities around is incredibly challenging. And I think for a lot of kids, it's the lost time with their friends and what that just does to their sort of sense of who they are, where they are, and what they're at, what they're up to. The second is just the difficulty associated with keeping track of how much they've learned and how much they haven't. We were talking earlier about the value and the importance of face-to-face. You know, I can tell if somebody's understanding me, even if they're wearing a mask, just by looking at their eyes and checking their body language. That's really hard to do in a virtual setting. And schools and teachers have done the best they possibly can to overcome that. And then the third issue is the difficulties associated with sort of a lot of the special needs kids who I think we're going to have a lot of work to do. I don't know if the superintendent or the commissioner want to speak to this.
Yeah, I think, I agree wholeheartedly with the governor. And, in Newburyport, we've really been taking a team approach. And I think, our staff and support staff really monitoring the potential learning loss for our students. So I think having the surveillance testing, adding more layers of safety precautions, allows us to have a phased-in approach and bringing more and more of our students back. So, our teachers just preparing for this fall, we were very fortunate. We had over 256 teachers. Instead of taking a summer vacation, our staff was coming in professional development for weeks on technology and just really working in preparation of the fall. So we anticipate in Newburyport a similar approach where we're going to monitor the learning loss from the spring once we bring more and more of our students back. And then we're going to really base our summer programming for students regarding that data. So That's where we're at. I think this is, for Newburyport, the first step in the right direction of a phased-in approach of bringing more students back into the classroom, with the ultimate goal of having all of our students back before the end of the year, and really preparing for the summer and working towards the fall. We always say, working with our community and the staff, that there is light at the end of the tunnel here, but we can't run to that light. We have to be patient. We have to maintain our safety, and then all these little steps that we put in place just creates a safer environment for everybody. So.
As for the pool testing, can you explain how students' classes are selected and kind of what we saw over here?
Yeah, so we're having a phased-in approach with the pool testing. So we've been testing our system right now. So we've had teachers coming in along with students coming in this week to make sure our systems and the tracking and working with CIC and our partners, everything is going well. Next week, we are going to increase the numbers with staff and students. And then March 7th, we're going to have a comprehensive testing program for all the grades and throughout all the schools. We're phasing this in just so we have success. And then what's really great for us and our medical advisory team and our nurses and teachers, it allows us to have real data on COVID prevalence within the school system on a daily basis. So you're not making assumptions, you actually will have specific data, which will then guide our decision-making on the numbers of students coming back. So we're excited for this program. And Kathy Riccio, our nursing team, our medical advisory team, we've been meeting weekly since March of last year, and that collaboration has been very effective for us.
Thanks, everybody.
One comment on that question? Good job. Sure. Track it.
So I guess what I'd say is the schools have done an amazing job of trying to stand up these new vehicles of education, but nothing can replace in-person instruction and the traditional method that we've done. And as we go forward, this isn't just kind of a summer school thing that needs to be fixed. I think it's going to be a several-year process to get our kids back to where they need to be. And that is both academically, but before that, I think we have to work on the social emotional needs of our students, make sure they have everything from the food they need, to the counseling services, to the special education supports. As a former special education teacher and adjustment counselor, I can tell you we've got to make sure our kids are in the right place mentally, and then after that we can take care of the academics. And that's what we're going to do.
Thanks, everybody. And thank you to the Newburyport folks for all of your work on this. Bravo.